themselves, the curricular changes have been developed through partnerships with IMD members. Our own strategy for Rush is multi-part, but a key part that we've talked to with our board and everybody in the place is that we cannot be successful and reach our own vision without Rush developing even more effective partnerships. So we are extremely fortunate that the IMD has such great leadership today, and the IMD has such great current and potential future partners. Thank you.
Thank you.
Welcome, Dr. Skip Garcia, Vice President for Health Affairs. And what we do without the wonderful colleges, healthcare science that your institution brings to the IMD, as well as the hospital and patient care services that you provide. Very honored to have you with us today.
Well, thank you so much for the opportunity to be here. I just want to join my colleagues' voice in lauding the Commission for its strategic thinking and vision. Its wish to be the organizing principle by which the talents of the Illinois Medical District come together, and perhaps defining new models of healthcare delivery that embraces research, translational research, and clinical research. I think the opportunity for the IMD to lead, and for the Commission specifically to provide this unique connectivity to the city and to the state is really so totally laudable. I think one of the reasons that we're so excited by the vision and the goals that we've heard today and that have been outlined specifically by the Commission and in their vision via the BCG report is that these goals so well dovetail with the goals and aspirations of our own University of Illinois health system. We also believe that through collaborations with our IMD partners and with the leadership of the IMD Commission for sure, that we may be able to actually move very aggressively towards delivering personalized health for folks within our communities, particularly those that are at risk and they're experiencing serious health disparities. In our own shop, we've pushed hard in expanding the infrastructure around clinical research and developing the expertise that I think will be very useful in collaborating with the other IMD partners. We totally believe and agree with the Commission's feeling that the Illinois Medical District should serve as a portal for conducting large-scale clinical trials that serve diverse patient populations, which is, I think, a uniquely important and currently lacking part of healthcare and clinical research. The ability to move towards management of population health, populations in unique ways that are individualized but yet racially and ethnically specific approaches, I think that's also an opportunity for us here within the Illinois Medical District. These obviously need the opportunities of mining critical clinical data, and clearly the Commission and in their vision has promoted this in a very unique way. And I think our efforts and collaboration with the other IMD partners will be critical in this area as well. You know, figuring out how to utilize mobile health technologies and the application and development of these technologies for patient care is going to be really important. I think the vision of the Commission in moving this forward will bring industry and I think potentially advances in this area. I guess finally, along the lines of translational research, University of Illinois, as everyone here knows, is a very research-intensive university. We, through each of our campuses and within the health system, are very aggressively pushing translational research and the application to affecting health disparities in our own neighborhoods. I think whether it's the transplantation in unique ways of patients with sickle cell disease that will cure sickle cell disease, whether it's the identification of gene signatures in peripheral blood that allow us to identify new biomarkers and new targets for therapies in complex diseases like type 2 diabetes, like heart failure, so prevalent in our patient population here, or the application of genetic studies that allow us to individualize the therapies for patients that need blood thinners such as warfarin. I think these all kind of highlight the idea that the University of Illinois, along with the Illinois Medical District, are really interested in minding this interface between clinical medicine and translational research. So I guess I would just end by saying we're highly excited about this partnership and want to laud the leadership here in being able to provide the collaborative environment that I think will turn out to be uniquely impactful.
Thank you, Skip.
Thank you. I'd like to acknowledge the presence of the County Commissioner, Robert Steele. Welcome, Commissioner. And Alderman Barnett was here with us for a few minutes as well. I know he had to leave, but I want to acknowledge and thank him for coming by. We would not be, and we will not be, and cannot be successful in achieving the goals of our strategic planning process and our strategic vision without the involvement of the private sector. It clearly has to be a partnership, public-private partnership, and to that end, we have a couple representatives of the private sector industry that we've asked to make a few remarks. First is Brian Kelly. Brian's with Quintiles. Thank you for making an effort to be here with us today.
Thank you. Well, first, good afternoon, and thank you, President Woodard and Mr. Brigley. First, Quintiles is just delighted to be here, and we really appreciate being invited into these discussions, and we really do look forward to working together. As some of you may know, or some of you may not know, Quintiles is the world's largest clinical research organization. Our 27,000 people, that include 850 doctors and 800 PhDs, perform hundreds of trials every year in over 80 countries around the world. Our core competency is effectively